Welcome to the Healthcare Executive Podcast, providing you with insightful commentary and developments in the world of healthcare leadership. To learn more, visit ache.org. And without further ado, your host.
Hello again, everyone, and welcome to the Healthcare Executive Podcast. Very excited as our guest today is Scott Gaydos. He is the Vice President of Product at Optum. We are proud to have Optum as an ACHE Premier Corporate Partner. Our Premier Corporate Partners play a vital role in supporting ACHE's vision and mission to advance healthcare leadership excellence. Scott provides strategic direction for Optum commercial IT performance services and leads the exploration, development, cultivation, and execution of new IT services products that drive digital value for Optum customers. He has 30 years of healthcare IT experience and has served in numerous senior positions, including CTO, CIO, and engineering leadership for a number of organizations. He has a degree in Management Information Systems from Penn State University. With that introduction, Scott, welcome to the Healthcare Executive Podcast.
Thanks, Eric. It's great to be here.
All right, so let's start talking here. When we first hear about things like workplace modernization, what would you say that means for hospitals and clinicians?
Yeah, it's great, Eric, when you say, what does that mean? I love definitions and context are so important in this space. So like we say things in this business like digital and cloud and AI, and without context, it's really hard. So when you say things like workplace modernization in hospitals, I think about this group of healthcare execs that I was with a few weeks ago that really helped bring a lot of context to this particular question of workplace modernization. And there, the statement was made that administrative burden is the number one stressor for clinicians, and it's the primary cause of burnout. So when we think about things like workplace modernization, then the first place to look is how do we ease that administrative burden that gets in the way, right, of healthcare delivery. And so what I would say is in that vein, there are like two primary groupings of this administrative burden. One is working with the EHR. That's a whole animal all by itself. And the second one is everything else, right? In sort of the administrivia of trying to execute healthcare. So like with the EHR, modernization there focuses on like, how do you craft the most efficient and effective workflows that both contribute to the best clinical outcomes while also like easing potential administrative tasks. You got to maximize integrations and automation between that EHR and non-EHR. And then you get even further and you look at things like ambient technology that sort of listen for notes and connections, and then creates a virtual assistant for clinicians whose primary job is to ease the stress that's associated with like taking notes or looking up information. And then you got the everything else side of that equation. So this is where you have opportunities of things like, how do you ease like the simplest areas of like, I forgot my password, or I'm locked out of system X, to like virtual bots that help you acquire necessary software that you need, or even onboard and train new staff. So I think about this one organization that we worked with. It was a mid-sized hospital system. They have about 15,000 calls a year to their help desk for what is essentially, I forgot my password. That requires the equivalent for that organization, about one full-time staff member. Now it's not one person, but it's like the equivalent of one FTE to do nothing but deal with, I forgot my password. Not to mention the amount of lost time and frustration on the end user, who's usually a clinician or healthcare administrator. And so like that kind of burden is simply rectified by like simple self-service options. And I think the last thing I'd say, right, in this kind of, like definitional context, it's not just simple things, right? Like that password reset, like super simple. That doesn't move the needle, right, overall. But all the other stressors of like, hey, why do I have like 5 logins to log in to different devices, different applications? How come the integration between all of these things doesn't work all that well? And I have all this duplicate entry. Or you've got like efficient and effective means to help staff like collaborate with one another. We're on a Zoom meeting today. How do you make this communication with one another and with patients, a lot less stressful? So all of those things individually are pretty small, but they're annoyances. But when you add them all together in the daily work of trying to actually administer healthcare, it's like extremely overburdensome with administrative tasks. So these kinds of solutions or things like this that help hit these stressors. This is how you address, some of the workplace modernization that is really the challenge that we're talking about today.
Okay, how about another word we throw around a lot without context? Data. What is the role data plays in workplace modernization?
Yeah, Eric, I love it. Right? I'd say that in a lot of industries, and healthcare is no different. Data ends up being the lifeblood of decisions, right? That get made, and in this case, it's clinical decisions, it's administrative decisions, and the thing is, decisions will get made on the data. So it's critical, right, to have that data be accurate, uh, timely, and consistent across the enterprise. So you've got a whole bunch of disciplines in that space. You have data governance, data quality, data management, orchestration. These are sort of core things that need to be in place to have this reliable data ecosystem. So we had just talked about, you've got the EHR and then everything around it. So managing all of the data of the healthcare enterprise is really necessary. So it leads to the stress of, is it in the EHR or is it not in the EHR? And your data strategy has to incorporate both of those things. So in it and out of it. And then there's data, there's data about patient care, and there's data about patient administration, and then there's data about like the business of healthcare. Both of those things are important. The former patient data, when you help modernize that, it helps modernize the delivery experience, right, for both patients and providers alike. And then like when you modernize the other elements, you start to understand where some of the high cost comes in of delivering this care to patients. So simply, I'd say that the proper capture, proper governance, and then the proper movement and leverage of the data is critical, critical piece, if you will, to modernizing that healthcare workplace.
So let's move on then. In your opinion, what are some of then the greatest opportunities we have now for automation when it comes to making an impact? And we're talking about ultimately outcomes here for outcomes and patient experiences.
Yeah, agreed. And we can never lose sight of the fact that these outcomes are the most important thing. So, regarding automation, I think I'll give you three quick examples, kind of a top level one, and then we'll get a little bit deeper because
Okay.
there's automation shows up at different places. Top level example, I'll go back to that. I mentioned it briefly, that ambient technology. So to be clear about this, I'm talking about like tech that is centered around, listening to patient and provider interactions, generating a note and the related data from that interaction. There's really incredible opportunity to both reduce the clinician stress as it goes, as well as create sort of a far better clinical note, and that itself then leads to better analysis of the note. By the way, both automated and human-based analysis of the note that potentially, right, can lead to better outcomes. That's like a real high level, really good example. To get a little bit more tactical, and you think of things like generative AI. Generative AI, showing really good promise at things like effective letter writing. So, utilizing that to help write letters, note letters and such, to enhance that provider to patient communication, while at the same time of lessening the burden on the writing side, for the provider. So there's still, like, you can't just shoot out an AI generated, letter. You still got to proof and you got to validate, but the initial writing can really be automated better in time. And then last one, like super low level, there's quite a bit of automation capability for things like assisted medical coding, right? Or do we put the right codes in there for the encounters? How do we automate and streamline the claims ecosystem then in a fee for service model, which could really focus on reducing that friction that's always there between a provider and a payer, and then just opportunity around general workplace. So like I need this software on this device, or I need access to this system, or like my headset that I'm on, oh, it broke, I need a new one. Those daily occurrences cause stress, and so much of that can be automated via self-service to really just reduce that.
So you did a great job of kind of laying out what some of these technologies are. And for our listeners, I'm sure they're listening going, okay, but there are obviously some challenges with implementing what you're talking about. So what are those challenges that you have seen, and what strategies do you recommend our listeners using to overcome some of those challenges?
Yeah, so this is great, right? I love it's not you can't just throw out challenges. You got to say, okay, but what can you do, right,
Right.
about this thing? So I love talking about it this way. So challenges, right? We just talked about automation and some of the tech that's in there, and as much as we can, we should leverage automation, but automation isn't always the answer. Why would it be? You just said we should do automation. So automating a bad process that can make the bad process go faster isn't a great solution, right? Because if the problem is the process itself, then automating is really just a band-aid around the real problem, which is, in this case, that would be process reengineering, right? So one challenge could be pointing automation at something that automation is not going to be the cure for the real root problem, which might be the process itself. So you gotta, in that case, you have to evaluate, should I even be automating this process as is, or do I need some kind of process reengineering? And then further, like in another challenge, we focused on, we said earlier, definitions are important. So you hear a lot today, digital strategy, and it's important, right, to understand in a digital strategy, by the way, which is not just about throwing tech at a problem. It's
Right.
really thinking about what part of your business you need to redo or undo. So in this case, do we have a process reengineering, or do we have a process that's maybe not necessary at all? So before we automate that, we need to think about a digital business strategy that might involve a wholesale removal of a process or some other one, and then think about digital enablement for patients and members, or in a payer setting would be members, right? And then your staff. And then, even more, maybe another challenge here is some of these automation technologies. So one that comes up a lot is RPA, right? Robotic process automation. And it's meant, RPA is meant to be in the hands of what might be a citizen developer, right? It's, you don't need, software engineering background to do a lot of the things with automating through RPA technologies. However, the more detailed you get and the more complicated the process is, the more that turns into actual programming, which then requires a different skill set than what you originally thought. So if the idea was going to re-engineer some of these processes, we're going to overlay RPA on it, and we're going to have not non-technical, but sort of business-oriented process developers build these things. But then you get into more detail, and you're like, oh, I actually need like software engineering here. I've thought about this the wrong way. And so that can be a real challenge. So like automating the right things, choosing the right tech to automate it, and then understanding the skill level. These are all big challenges to overcome. So then you mentioned, well, what do you do, right? What do you do about that? So process reengineering at a minimum, right? It's process evaluation before implementing any automation on top of that. And this is a sort of a holistic business planning, right? Taking into consideration the business itself and what the processes are before the technology implementation. And then another strategy here, and this can't be overemphasized, but training, right? Training is a huge mitigating factor for all of these challenges. It might be training those citizen developers that I mentioned on how to best use RPA tech, or it could be process reengineering training that, and what needs to change about the process. And then the most important part, why are we making those changes? How is it beneficial to the organization? So training, communication, proper staffing, and then, you know, business process before tech. These are strategies, that we can really look at here.
Yeah, such a great takeaway. Process evaluation before just throwing tech at an answer. Okay, so let's just say we're deciding to adopt some of this automation, and it's not like you make the decision on a Monday and then everything is running smoothly on Tuesday.
Right.
Talk about what's required for an healthcare organization to make that transition, to successfully make that transition. You've mentioned some of it, training, going through the proper steps, but what can help an organization go through the transition process?
Yeah, that's it's great, Eric. You're so right. It's not implement and everything is wonderful, in a day. So the first part of that is then have a plan. Okay, gotta actually have what is the actual plan of transition, and if there's a transformation, which there usually is, especially if it's truly a digital transformation, have that plan, communicate it, and communicate the why of the plan over and over and over again. It's so funny. So too often we get bogged down in the what and the when of a plan because that's what shows up. The why of a plan is so important in transitioning an organization. So like just when you're like super sick of saying it for the 100th time, somebody is just clicking. The pieces are just clicking together in their head for the first time. So there's no such thing as over communicating when it comes to this any kind of modernization effort that's there. So if that's first, then the second part is really be careful about how much change is in each of these transition stages. Organizations can only absorb so much change at once. And so determining, what's the threshold for my organization? What does it look like? And then plan accordingly of these stages, how many, stages of transition and change are necessary. And then the third part of that would be follow through on the full chain. So too often, we deploy technology, but maybe the process doesn't fully transform to the desired state, and you end up with like half a chain that's completed, and that just ends up feeling like a tech implementation that, by the way, adds to that frustration and administrative burden. So complete the full chain, the processes and the tech.
And you have so much gold. I'm just writing so much down. Don't get bogged down in the what and the how of a plan and forget about the why. I think that's just so critical to retain that piece of knowledge right there. One of the things we talk a lot about on the Healthcare Executive Podcast is diversity, equity, inclusion, is health equity. And so I want to ask you about is Scott, how can IT modernization and automation, the support we've been talking about, how can it create more equitable access to care and better outcomes for underserved populations?
Yeah, Eric, that's a great one, right? Because I think and here we're talking healthcare, but in general, technology and especially easy access to technology can be just a great equalizer, across industries. And in this case, we're talking about it being an equalizer in access to proper care. I saw that the other day, and then I had to look it up just to make sure because you never know, right? Be careful with the stats. And I just came from the Census Bureau. I feel pretty good about it. But it said that, as of last year, as of 2022, 92% of Americans have some form of health insurance, which is great. That's a pretty high percentage. But on top of that, 85% of Americans have access to a smartphone, not just a cell phone, but a smartphone, right? So you've got 92% of people that have some ability to pay for care, and then 85% of those that have smart mobile technology that is available to access some of the ways in which care is changing. So when you look at things like modernizing IT and healthcare, we can't ignore those stats. You got to take into consideration, hey, a smartphone as a channel is a nearly ubiquitous way of interacting with patients. So how do we maximize that channel? By the way, this isn't new revelatory news. We
Sure.
know these things, but it becomes such an important channel. And so if we do that, then the other element in the IT estate, right, of healthcare, then we say they need to become more mobile friendly. They need to embrace changes in how a channel like that opens up patient access. But like we said before, it's not just technology. It's looking at, what are the processes that need to be rethought so that if we're sticking with something like mobile and mobile as a channel, then what parts of our process need to be removed or wildly changed so we can take advantage of that kind of channel. So I mean, all in all, that's just another example of this interconnectedness of technology, process, and culture that's sort of throughout the health ecosystem. There's lots of great modernization work that's going on in providers and payers, life science orgs and government health. And it's just great, right? To be a part of that and try to help how, we help, provide solutions and better access to care as well.
Well, I hope some of our listeners are writing some of this stuff down the way I was. A fantastic conversation. You've been listening to Scott Gaydos. He is the Vice President of Product at Optum. We thank Optum, of course, for their support as an ACHE Premier Corporate Partner. Scott, thank you so much for joining us today.
Thanks so much, Eric.
And we thank you all for listening. As always, we'll catch you next time right here on the Healthcare Executive Podcast from ACHE.
This has been the Healthcare Executive Podcast, brought to you by the American College of Healthcare Executives. If you've enjoyed the show, please consider rating and reviewing on iTunes or your podcasting app of choice. And for more information, find us online at ache.org.